Hi, I decided to do my research paper on reproductive health, with a specific focus on looking at pregnancy care and birth control practices within correctional facilities. I picked this topic as I have always been interested in women's health and reproductive rights. As a woman, I find it incredibly troubling that not all women have access to proper health care when it comes to things as important as pregnancy and controlling your own reproductive freedom. I also work with the Aurora Center and focus a lot on trauma-based practices that are most effective, and I thought my work combating sexual violence had a similar thread to reproductive rights within correctional facilities. This topic is important as 6 to 10% of women are pregnant during intake of incarceration, and facilities are failing to support these women during a very vulnerable and difficult period of life. Although women still make up a small population of the huge prison industrial complex, the population is growing fast and needs more support. Generally, women in prison have more specific health problems than men, and many women who enter correctional facilities have little support for their specific health issues, especially focusing on reproductive health like birth control access in pregnancy. There is a heightened urgency to address this topic, as the rate of recidivism will only increase if women are not given resources during incarceration and post-release. The women who are incarcerated also experience a greater number of health risks than those in the general population, including stress, exposure to violence, and poor nutrition that can lead to serious pregnancy and delivery complications. To address and interrogate these specific needs in correctional facilities, Kelsey and colleagues in 2017 conducted a study to examine accommodations and medical procedures followed by regional jails for pregnant women across the U.S. The study surveyed 384 city and county jails across the country from 40 states, asking them about their common care practices like pregnancy screenings and general medical care. This study found that the majority of jails do not charge for OB/GYN medical services, and for those that do, the copay charge is $15. This is incredibly disappointing to hear because many prisons and jails only offer work for very low hourly wages, which can create a competition of needs within facilities on what women spend their money on. Additionally, 1/3 of the facilities stated that they do not have on-site OB/GYN care and have to transport outside of jail. Facilities often feel burdened to see outside resources in these situations, as it hurts convenience, cost, and security of the facility, accentuating the fact that many facilities choose convenience over proper care when it comes to adequate health care for pregnant women while incarcerated. Knowing that pregnancy while incarcerated can be an incredibly traumatic experience, it is important to investigate the risk factors that go into an unplanned pregnancy. In a study, Clark and colleagues screened the historical and current health of women who are incarcerated at the Rhode Island Adult Correctional Institute, otherwise known as ACI, to examine the risks and potential risk factors of an unplanned pregnancy within 6 months following release. The study found that during the 3 months prior to incarceration, many of the participants were sexually active with a history of sex work. Many of the participants also used a form of birth control, but 40% reported their health as poor. High majority reported drug use and drinking during the past 3 months, and the majority had a history of pregnancies with a median age of 17 at time of first pregnancy. 83% reported having an unplanned pregnancy, and 35% reported having an abortion in the past. The median number of pregnancies was 6, with a median of 2 deliveries. Both the Clark and Suffren studies show how much correctional facilities are lacking in support towards pregnant inmates. Understanding that the many factors that go into an unplanned pregnancy and the practices for pregnant women while incarcerated show the wide scope of health issues that pregnant women may face while incarcerated. High risk and unplanned pregnancies are huge issues within jail and prison walls that can cause many pregnant women pain and discomfort. In order to combat this issue, birth control services, including abortion, may be beneficial. Although for many women in prisons and jails, birth control or family planning are not easily accessed while incarcerated. I looked at 2 studies, one conducted by Suffren and colleagues in 2009 and Clark and colleagues in 2006. Suffren conducted their study through a survey to evaluate birth control access in correctional facilities across the U.S. This study mailed questionnaires to 951 correctional health professionals across the U.S. that included questions regarding abortion services, contraceptive counseling and provision, and general medical and reproductive health care for incarcerated women. The study illuminated how Medicaid influences abortion fees through highlighting how in 26 states abortion is considered very restrictive, and Medicaid will only pay for abortions if life of the pregnant woman is endangered or she is a victim of rape or incest. but in 18 states, they have at least a least restrictive guideline where Medicaid will pay for all medically necessary abortions. This example shows how little standardization is among correctional facilities across the nation, which can cause harm to women. For the study, 68% of the healthcare professionals reported that if a woman requested an abortion, she could receive one. But facilities that allowed women to continue their pre-incarceration contraceptive were more likely to permit an abortion than facilities that did not. Many correctional health providers asserted that incarcerated women are allowed to obtain an abortion, but when questions about the details of facilitating the procedure, inconsistency emerged surrounding the transportation, help arranging appointments, and other logistical assistance. For the Clark study, they looked at ways facilities can improve birth control services for women while they are incarcerated. They surveyed women coming into the Rhode Island Correctional Facility to compare two varying phases of family planning services. During Phase 1, a nurse educator met with the women at the Rhode Island Adult Correctional Institute and offered them referrals for contraceptive services at a community health clinic after their release. During Phase 2, contraceptive services were offered to women during their incarceration. The results of the study showed that the majority of the participants reported a desire to initiate use of birth control methods. Within 4 weeks of their release, 4.4% of Phase 1 participants initiated the use of contraceptive method, compared to 39.1% of Phase 2 participants. Therefore, the study's results show a need of providing birth control in facilities as it increases birth control initiation compared to only providing services in the community. Pregnant women are not receiving the guidance, support, and care while incarcerated due to harmful practices, including shackling, lack of nutritious foods, and the absence of prenatal screening. There is a specific need to make birth control accessible in correctional facilities through providing options of birth control, offering logistical guidance when acquiring birth control, and educating women on what they can do to acquire birth control post-release. Without providing various guidance and support that all pregnant women need while incarcerated, women will continue to go through an extremely difficult period of life alone and afraid, and the rate of recidivism will not decrease. Although substantial research has been conducted and great strides have been made in examining reproductive health care in correctional facilities, there are still valuable gaps that must be addressed. As mass incarceration has increased immensely over the past decades, the need for research has grown. Due to this, there is a little access to find data and results that provide a general scope of the incarceration system nationally. As shown in the studies highlighted, many studies focus on a particular facility, but as there is little standardization and uniformity between facilities and the practices they use nationally, it is hard to generalize results to the United States as a whole. In addition, much of the data present is either cross-sectional, self-reported, or both, which can create room for bias and falsehoods. Additionally, cross-sectional studies limit the researcher's ability to collect longitudinal data to infer long-term effects. Due to these limitations, it is imperative that more longitudinal and nationwide studies are administered with fidelity to provide the most accurate and beneficial picture of reproductive health care while incarcerated. Ultimately, more research is needed to acquire a more national database of how facilities are supporting pregnant inmates, as many of the studies only focus on one facility or area. To help attain this goal, there should be a heightened urgency to hold correctional facilities across the nation to the same standards that offer the same procedures and options for all pregnant women. By offering uniform, adequate, and quality care, the rate of recidivism will lower for women, and women will have more success post-release no matter where they are incarcerated. The incarceration system has a unique opportunity to stop the cycle of recidivism and help certain populations of women receive the proper health care they deserve. Thanks for listening, and thanks for a great semester, Rebecca.